A measles outbreak in Philadelphia is raising concerns here in our area. Our CBS News Innovation Lab has found measles vaccination rates are not quite where they need to be. CBS 2's Jessica Moore sat down with local public health experts to find out what needs to be done to keep our kids safe.
From Philadelphia to New Jersey, cases of measles are being reported, prompting concern among health experts nationwide.
I think it's very alarming that diseases that we used to know, we used to have, are now re-emerging in a time when we actually have very effective vaccines against these diseases.
Dr. Wafa El-Sader is an internationally renowned expert on infectious disease and a professor at Columbia University. She remembers life before vaccines stopped the spread of dozens of deadly diseases.
I've had people in my own family who had polio. I've had people in my own family who've had diphtheria and measles. So I think I have a very personal experience with the devastation of these infectious diseases. So it's just ironic to me how now that we have at our fingertips these amazing vaccines, that we remain hesitant to take advantage of them.
Dr. El-Sader says vaccine hesitancy, often fueled by misinformation on social media and a widening distrust in medical experts post-pandemic, is becoming an epidemic of its own.
It tells me that we can anticipate that if we don't address vaccine hesitancy, we're going to see more and more of these outbreaks in the future.
But the question is, how? We asked the city's health commissioner.
It's not just about going into a community with low vaccination rates and saying, go get vaccinated. It's about saying, what's most important to you? And then we can talk about how vaccination and childhood vaccinations are a foundational element of building health for our children.
Vaccination data analyzed by the CBS News Innovation Lab shows New York State has a 98% MMR vaccination rate. In Connecticut, the rate is 95.7%. And in New Jersey, where health officials have documented a single case of measles, that number is 94%, which is just 1% below the rate needed for herd immunity. That's when a large portion of a community becomes immune to a disease, typically through vaccines. If enough people are resistant to the cause of the disease, it has nowhere to go. New Jersey health officials say after the confirmed measles case in Camden County, the state health department sent alerts to providers across the state reminding people to be vigilant.
We want to ensure that people who might have been in contact with that case have been vaccinated.
And preventing the spread is essential because measles is highly contagious. According to the Centers for Disease Control, if one person has measles, up to 90% of people close to that person who are not immune will also become infected.
We want to be able to protect not only ourselves, but also our community at large.
Health officials say the goal is complete immunity, meaning a 100% vaccination rate among children and adults to ensure that the diseases of our past stay there.
We've learned even a fraction of a percentage point fewer people vaccinated can change herd immunity. Stephen Stock delves into this topic in a special report airing tomorrow. Jessica Moore, CBS 2 News.
And you can see that special report, Vaccine Vigilance, tomorrow on CBS 2 News at 5 o'clock.